right now on Indianapolis This Week, a Sunday exclusive.
It definitely could do better, and particularly for Hoosiers, we believe there's a better solution.
Today, the man overseeing the state's plan to expand access to health care. Is it better than Medicaid? Will the federal government approve it? A one-on-one with FSSA Secretary Dr. John Wernert. Plus the future of your local library branch, why changes could be on the horizon, and millions of dollars for children. Where is the money coming from?
From RTD6, the Indy Channel, this is Indianapolis This Week with Rafael Sanchez.
We begin with a Sunday exclusive. We're taking the pulse of the state's plan on health care access. Healthy Indiana 2.0 is at the center of that debate. In his first television interview, I sat down with the new secretary of the FSSA, Dr. John Wernert, who started in his new role just last month and is the first medical doctor to be appointed to that position. The biggest item on his plate is the Healthy Indiana Plan 2.0. I asked if it's the best option available. Here's our conversation.
Many of us have watched, particularly from the provider community across the country, the problems we've had with Medicaid. And we really believe that, Medicaid is a program that's helped a lot of people, but it definitely could do better. And particularly for Hoosiers, we believe there's a better solution, and that is why we've developed the HIP 2.0 program. As you know, we have experience with HIP 1.0, the HIP program that came out in 2007, and it's produced some excellent results, and we'd like to expand that to another 350,000 low-income Hoosiers in the state, so we can really focus on producing better health outcomes for our population. So we're very excited about HIP 2.0. We believe the enhanced benefits, and it's a very elegant benefit plan, and it puts people in a position where they can take personal responsibility for their health. We believe it's going to be very popular and work very well.
There's some criticism that if you had just expanded Medicaid, that you could include even more poor folks. The fact that people have to pay into the system, that could be a barrier. Do you see that, or is that an unfounded criticism?
I don't think it's an unfounded criticism in terms of numbers. I think the reality is how effective that is. Just giving someone an insurance card doesn't guarantee them access to care. And what I've seen on the provider side, being a physician myself and someone that's taking care of many patients who are uninsured and insured, that unless they have access to care and they take some personal responsibility for their care, then you're really not producing good outcomes. And I think with the established Medicaid program, patients don't have skin in the game. They quite honestly are in a position where they're getting some assistance, but they're not getting the most robust response they could get in terms of their health care outcomes.
You don't have a crystal ball, but you're going to be entering the federal comment period here in a matter of weeks, months. Will the feds approve this plan? Will the feds say, you know what, Indiana, you're showing us something that has not been done before, or that's something that can withstand scrutiny?
I believe CMS has seen Indiana as a leader in many areas, and this is an innovative program. There's no doubt that it's much different than traditional Medicaid. We don't believe this is an expansion of traditional Medicaid. It's not at all. It's a very different plan. And there's going to be a lot of education that needs to go along with that, particularly with the consumer-driven portion of the HIP plan.
Mental illness still has that stigma. As a psychiatrist, how do you sort of bridge that gap so that people can either get those services and remove that stigma?
There's two ways that I think really work best. One is the whole effort we've put into integration or integrated mental health care. That's providing mental health care at the primary care site, whether that's a federally qualified health center, a rural health center, a community health center, or your primary care doctor's office. If you know that you have access to those services in a primary care setting, we believe you get much better outcomes because you're not dealing with the stigma as much. You're not leaving and going to a separate mental health center or going to a psychiatrist's office. So we're embedding those services into primary care settings, number one. Number two, it's the law of the land now that mental health parity exists, which means that mental health services should be covered on par with physical health services. So whether it's co-pays, deductibles, lifetime limits. These are covered on par. Indiana was a leader in this, one of the very first states to approve mental health parity. As folks see more and more that mental health problems and mental illness can be treated effectively, and that it doesn't have to shorten your life or impair your ability to function or to work, then they realize that this is a chemical illness and a physical illness, much like having diabetes or heart disease or even cancer in some cases. Unfortunately, when you have situations like Robin Williams, who was someone I think many of us admired and really enjoyed his work, you see that this mental illness affects so many important people, actors, many musicians have suffered from it, and very creative people tend to also have a lot of problems with mood disorders. Unfortunately, when they go untreated, you see the outcome, and it's a very tragic outcome. But we know that there's many thousands of families in Indiana who suffer with their loved ones who have these mental illnesses, and so it's an important piece to our rollout of HIP and any of our health plan initiatives here at FSSA, that mental health services are going to be covered on par, that there's not going to be any financial or disincentive to getting care, and that we have an adequate network of providers out there who are going to care for folks where they need the care, whether that's in their home, their primary care offices, or in the more severe cases at mental health centers and psychiatric offices.
You just started this job. But how do you want the taxpayers to hold you accountable? What's going to be your footprint? What will be your legacy when it all is said and done?
We have to come up with a set of very good measures to determine whether people are getting good health outcomes. You know, it's not fair to criticize the Medicaid program or any federal or state program based on theory. We need to show that you can get better health outcomes by making certain services available. So we have an expanded services through HIP. You also have to have good measures to ensure that people understand that what we're monitoring really does matter, and that includes, are you able to get back to what we call useful life work? Not necessarily employment for those that can't work, but are you active in your community? Are you doing things to give back to the community, active in your church or with your family group? And I think that's the legacy I want to leave. I want to take an agency that in the past has been maybe very focused on the economics of how we try to help so many of our disadvantaged Hoosiers and really put those dollars to work where we're seeing some results.
To that end, the Secretary says another priority is for the agency to work in concert with its providers to make sure people get the best services. Technology is changing the way we use our libraries, but there are more changes coming to libraries in Marion County. Some branches could be moving around. Indianapolis This Week continues right after this. Changes could be coming to an Indianapolis Public Library near you. Not only is technology changing our libraries, but so is how we use them. Jackie Needus is the CEO of the Marion County Library System, and she is today's Sunday Spotlight. So we're here at the Central Library, plenty of books to read, a lot of things going on in this place.
Absolutely. It's a very exciting time for the public library.
As you look forward, because you are planning ahead for the next 5 years, you're looking into the future, one of the main topics you're focused on is increasing access.
Absolutely. That's probably fundamental, because if we've got a public library and people can't get to it or they don't know how to use it, then what's the point? So access, whether it means new locations, whether it means moving some of our libraries, whether it means figuring out what is the barrier for someone to use their public library, we're going to be focused on removing those kind of barriers.
In fact, you're looking at some parts of the city, to the west side, where you've seen some major growth. You mentioned even Lawrence. So what does that look like? Because often when people say, oh no, realignment, does that mean something's going to close or something going to move? What does that honest conversation look like?
In many instances, it's just a relocation to a better, more accessible site. For example, on the far west side, where the Eagle Library is kind of tucked away, and we'd like to get it out where people can find it more easily and make it bigger, because that's a very busy community library over there. In some cases, like down in Perry Township or up in Lawrence Township, there's just been so much population growth that they need another access point. They need another branch library, and we're going to try to make that happen.
When you talk about innovation, what does that also look like? Because we're all now moving to the e-books. But as I look around us, there are a lot of books here. So
Well,
are we getting rid of the books?
We are still heavily in the book business. Over 90% of our circulation is still in a print book like you see surrounding us. But a lot of our other activity now is on the e-book or an e-magazine, an online magazine. Maybe it's a downloadable piece of music that someone wants to listen to instead of checking out a physical CD like they used to. So certainly there are innovations in the collection. There's also innovations in services too. We want to be the place where people can learn about new things. That might mean they come here and try out Google Glass. They might mean they come here for a demonstration on a 3D printer. We're not even sure what all the new innovations will be over the next 5 years, but our focus is going to be making sure that people have a chance to learn about them with the help of their public library.
Have you been amazed by the technology? We were kidding off camera. My kids don't know what a cassette is or a Walkman is, and are you impressed with all this technology?
It is a phenomenal, almost a tsunami sometimes to keep up with it. The younger people do better than some of us do, but it is actually something that at all ages we've got to be working on. That's why we send the Tinker Station around to all of our buildings on a regular basis so people can literally be hands-on and try the different new kinds of technology and see what works best for them.
Do you think books will ever become extinct? There's always this push about people, with the e-readers and the Kindles, but I think people still want to smell and touch a book.
There still is a huge volume of books being published, and that's because people are still buying them and using them. In time, we will see a shift in that, but it's not going to happen tomorrow. Not at all.
You are a big advocate of reading. In fact, you have a business card, and you encourage everyone, whether it's verbally or even with that business card, you want people to read to their kids right now.
Absolutely, Rafael. That's why I put it on the back of my business card. It says, find a child to read with each week. This is the most fundamental thing. If we want our children to succeed in school, if we want them to succeed in jobs later on, they've got to have that fundamental skill of reading, and hopefully they see reading as something pleasurable, something positive. If they see their parents reading and they are a reading role model, they're going to read. And that's one of the messages that we have for the community. One of the reasons to increase access is to make it easier for people to help our children read.
And you have plenty of books for them to pick up.
We do, and we'll make that as easy for you as we possibly can.
Jackie Needis, CEO of the Marion County Library.
Thanks.
Thank you so much.
Thanks for stopping by.
Oh, beautiful place. Thank you for inviting us. We appreciate it. And Read Indiana Read. The library's strategic plan is on their website in the news and announcements section. Next, millions on the table. The governor's reversal of opinion on an issue that will impact families and children who were adopted. Joining us now are two of our political insiders, Republican Jennifer Hollowell and Democrat Laura Beck, around the round table. It seems that public pressure wins. Parents that were promised state assistance for adopting special needs children will now be able to get assistance sometime next year. Does it show that if the public raises a stink, that they can beat back the system?
Well, I think any time the public comes forward and says this is an issue of major concern to us, I think elected officials should listen, and I'm glad Governor Pence did listen. I just wish he would have done it a little earlier. Anyone who is a parent and anyone who is friends with or parents of adoptive children, and children with special needs particularly, know how hard it is to take care of the children, to make sure that they get everything they possibly need, because in schools you have IEPs, you have all of these different things you have to manage. So the fact that this funding was withheld from them is really concerning, especially from such a pro-adoption governor. I think anytime we can have more adoptions, it's a good thing in our state, but I think it turned into a PR nightmare for them, and heading into 2016, whether he's running for president or governor or both, that becomes a major issue and a major problem. So I'm glad they did something. I just wish they would have done it sooner.
Change of heart or political?
Well, first of all, the governor has said that he wants to make Indiana the most adoption-friendly state in the country. And this positive step forward, I think, is a sign of that commitment. And if you also look at, in the last legislative session, they passed the adoption tax credits, and they're also, holding adoption fairs around the state. So I think that there are a lot of positive things happening on that issue.
I think anytime you can bring down the cost of adoptions, it's incredibly important, because it is very cost prohibitive prohibitive, and a lot of families will adopt children with special needs because it's not as expensive, or it's easier to do that. But there are so many costs that they have to incur, from medical to health to school to education, that they really do need these funds. And when you think about it, it's usually the children with special needs who are the last to be adopted.
And we're talking about 11,000 families and more than $90 million in assistance. The next biggest issue, of course, Loretta Rush will become the first female Chief Justice for the Indiana State Supreme Court. Ladies, is it about time?
Absolutely. Yes.
About time?
Yes, and I thought you had a great interview with her. I think it was that last week.
Yeah, and she said that she does not want people to make a big deal about this. Obviously, that it is a big issue for our state to say she's the first, but she wants really young women and women moving forward to say, you know what, anyone can do my job.
When I was a little, it is a good girl. When I was a little girl, my dad bought me a bag back from D.C. that said, "A woman's place is in the House and in the Senate," and I really didn't know what that meant as a child, and I'm certainly never going to the House or the Senate. But I think it's incredibly important that young women, older women, men as well, see someone like the Supreme Court Justice, the new Supreme Court Justice, as a woman, because it shows the equal nature that we all can do the same things, and it shows that women are coming very, very far in this country, and we still have a long way to go, but we're making major strides.
And I'm glad the bag said what it said, otherwise we'd have a different issue in this program. So I'm glad the bag was very...
Oh, yeah, that's true.
Yeah, so thank you very much.
I
was afraid.
Know with me.
Jennifer, come on Monday, the City County Council will begin to take a look at the mayor's new anti-crime initiative. Will we see something, will we see a movement on this? Will the Democrats embrace this?
Well, I certainly hope so. You know, it's a comprehensive plan. It focuses on prevention, protection, and punishment. There's lots of pieces to this, but the major pieces that have been talked about the most certainly are adding 280 more police officers, and also nearly doubling the number of pre-K opportunities for students in the city who may be low-income children and folks who we need to make sure are getting an education and are on the right path. And, you know, these are things that generally Democrats have supported, and you know, the mayor has offered a plan that is funded on the recommendations based on the bipartisan study commission that the council called. And so I hope that we can all come together and see this forward. And you know, Mayor Ballard has made big steps to meet with Democrat councilors, Democrat leaders, and he's taking this proposal all around the city to different neighborhoods and different groups. And there are lots of schools in support of it, lots of education leaders, and you know, not-for-profit organizations. And so I hope that this is one time that we can put politics aside and move forward on something that I think, generally speaking, everyone is supportive of.
Can your side of the aisle find that common ground on this?
Well, I think anytime. I mean, I think we have a public safety crisis in this city. I don't think there's any doubt about it. And I think anytime the budget comes up, having worked for the city of Indianapolis and Mayor Peterson's administration during that process, it is a give and take. It is a discussion. The mayor says these are my priorities. The council says these are my priorities. They don't always, may not get everything they want, but at the end of the day, they have to put together a budget that is funded, that is responsible. And so how that's going to look and how it's going to come out remains to be seen. But at the end of the day, this is a democracy. You've got Democrats in the council, you got a Republican mayor. Last year they showed that they could work together. So we'll see moving forward. The challenge, I think, for Mayor Ballard this year is this is an election year budget for him. And when you're going into that third term, your budget is a little probably more under scrutiny. And so now that we've got 3 Democrats in the race for mayor, I'm sure we'll be hearing from them throughout that process as well.
And do we have 3? Because we have 2 that are running.
I don't know if I would say we have to. I'm sorry, I may have misspoke. We have one that has filed an exploratory committee, and so that's taking the first steps. But I would imagine that the media may be asking questions, the public may be asking questions.
I think you have other folks who filed committees.
And we do have others, yes. So we do. I think we have others. But we have 3. We have 3 who are out there right now.
The Republican Party last week did raise some questions that Mr. Hawk said may have violated federal law by speaking of running for mayor while he was still U.S. attorney. Well, does that have any legs?
Well, I mean, I think it does. You know, there are some very legitimate concerns and questions that have been raised, and I think it's telling that Hogsett is not willing to answer those questions. But, you know, what the next step is, I think, remains to be seen. But clearly right now he's dodging He's dodging answering
You have 30
those
seconds.
questions.
Is he dodging?
No, he's not dodging. And as a matter of fact, when the very conservative editorial raters for the Indianapolis Star say it's smacks of fear and desperation, that's a bad sign.
There are lots of people
That's a bad sign.
across the city
turning it into
and in the
word.
media
Bad sign.
who believe
Bad
these
sign.
are legitimate concerns.
This conversation will continue
silly.
throughout the week and also on Twitter. Be sure to follow Jennifer, Lara, Kip, and Abdullah on our social media and join in on the conversation. Indianapolis This Week continues after the break. Today marks the 50th anniversary of a church with a mighty mission. Sunrise Missionary Baptist Church serves a tough neighborhood on the near north side of Indianapolis. During our visit last week, a murder suspect turned himself in to church leaders. It's not the first time that that's happened. The church is focused now on helping families fill their spiritual needs, as well as providing food and health services for the needy.
We feel that this is where God assigned us to this neighborhood, to do something and be a beacon of light on this corner. When a life changes and people turn their life over to Christ, there's just a euphoria about it, and it affects all parts of their life, and then they become better people in the community.
Congratulations to Sunrise. And thank you for watching. I'm Rafael Sanchez. For the latest news and weather, we are always on the RTV6 app and our website, theindychannel.com. Have a great Sunday, and we'll see you next week.